The federal government has postponed expanding medically assisted dying, or MAID, to include those with mental health disorders. But one man is speaking out about why he believes he should be able to access it. We have to caution you, this is a difficult interview to watch and raises the topic of suicide.
They ever deciding on my life? How dare they? How dare they take away that option? Give me the option.
John Scully is a former war correspondent. He covered 35 war zones, witnessing firsthand the worst of human suffering. He has paid a terrible price.
I have now suffered post-traumatic stress disorder, or PTSD, for 30 years. And that means that I have every single night of my life now. I get nightmares, horrific nightmares. But it doesn't stop. And there is no stopping it. I've had every cure tried. I've had 19 shock therapies. I've seen about 16 psychiatrists in my life.
Scully, who is 82, says he has tried to take his life twice.
I present myself as I would say, perfect candidate for MAID for the mentally ill. I am so sick.
Expanding MAID to cover those who suffer solely from mental illness was supposed to go into effect this March, but it was postponed for a second time this week by the federal government amid growing pressure. Most provinces, including Ontario and all the territories, signed this letter on Monday, asking the federal government to indefinitely pause the expansion to ensure appropriate safeguards.
Terminally ill cancer patients deserve every bit of help they can get, but I also need every bit of help that I can get.
In Ottawa today, Federal Health Minister Mark Holland didn't disagree with that statement.
We acknowledge that equivalency. The question is whether or not the system is ready.
Do you think Canada can be ready to expand MAID?
I honestly don't know.
Psychiatrists have been deeply divided on this issue. Some believe people can be assessed properly to determine who qualifies. Dr. Gand, who is a professor at U of T and head psychiatrist at Sunnybrook Hospital, disagrees.
We would need to know how to separate and distinguish suicidality that's being fueled by the person's mental illness symptoms themselves. Not only do we not know how to make those distinctions, we don't even know if it's possible to.
Dr. Gand believes the focus should be on helping people live better.
The Mental Health Commission has told us that less than 1 in 3 adults with mental illness gets the mental health care they need.
Close to 45,000 people have accessed MAID in Canada since it was legalized in 2016. You can see from this chart, numbers are growing every year. In 2022, just over 13,000 people chose it, which was 4% of all deaths in Canada. The average age was 77. 63% had cancer. Scully agrees rigid safeguards need to be in place to ensure people get MAID for the right reasons. He says if MAID was expanded, he wouldn't necessarily use it right away.
I want the option to be there to give me some comfort that someone is caring and that someone is going to look after me. And, I mean, not me personally, but we mentally ill people.
So what's next? The federal health minister is promising to introduce new legislation soon that will detail a new timeline. But will access to MAID open up further before the next election? Conservative leader Pierre Poilievre has come out strongly saying he is against MAID for people with mental health disorders.